Leader of the opposition, Joseph Harmon, during a virtual press conference on Tuesday, has condemned the PPP administration for its lax approach to combating the COVID-19 pandemic, even while a new strain of the virus has been identified.
There's an explosion of COVID-19 cases in Guyana, with over 7,000 confirmed cases and 170 deaths, as is up to yesterday. And with the PPP, of course, regime appearing inept in managing the spread of this pandemic.
On the heels of the new strain of the virus, the opposition leader posited that the country's borders remain open to inbound passengers, even from countries where the new strain has been confirmed.
Guyana's borders, as you know, remain open, and there's a daily free flow of persons from several countries where this new strain of the virus is prevalent. The measures that have been instituted at the Chadijagan International Airport for incoming passengers are at best lax and casual, and puts the entire Guyanese population at greater risk.
Harmon also revealed that his office is in receipt of information that several ministries have had outbreaks of the virus and that some ministers are demanding test results for staff members should not go to them directly, but should be handed over to their respective ministry.
We call on all government offices where there is an outbreak of COVID-19 to implement the COVID-19 protocols, and that the premises be thoroughly sanitized so that the lives of our workers can be protected.
On the heels of that revelation, Harmon called on Guyanese to protect themselves by following the stipulated guidelines. Those are washing and sanitizing their hands, wearing masks, as well as maintaining social distance. Meanwhile, on December 22, 2020, during the course of the daily COVID-19 update, Health Minister Dr. Frank Anthony said that Guyana is awaiting advice from the Caribbean Public Health Agency, CARPHA, as to how it should proceed with regard to travel bans to restrict the spread of the virus to these shores.
So we'll await some further guidance from CARPHA, and they have been talking to their virologists as well as virologists from PAHO. So once we confirm some of the mutations and understand the impact that these mutations might have, then we'll be able to make a more definitive pronouncement.
Early January, there had been a closure of the border between Brazil and Ghana, with limited commodities being allowed into the country. When this newscast reached out to the Ghana Civil Aviation Authority to inquire whether travel has been restricted into the country, a member of staff responded in the negative and further stated that persons traveling to the country are required to test for the virus 3 days prior to traveling. As of Monday, January 25th, Ghana has recorded 7,317 positive cases of the virus, with 172 deaths. 6,431 persons have recovered as of Monday. Wendell, Badrie, HGP Nightly News.